Welcome to Health Literacy Out Loud. I'm Helen Osborne, president of Health Literacy Consulting, founder of Health Literacy Month, and author of the book Health Literacy from A to Z. I also produce and host this Health Literacy Out Loud podcast that focuses on many aspects of health communication, patient education, and health literacy. Today, we have two guests, Tamara Huntley and Joanne Nicholson. Tamara Huntley is a licensed social worker and a passionate advocate for individuals with disabilities. Born with cerebral palsy, Tamara serves as the self-advocacy liaison for the Massachusetts Developmental Disabilities Council and contributes to research through Brandeis University's Bridges Project. Tamara is a proud single mom of two. Personally and professionally, her commitment is to create a more inclusive world. Joanne Nicholson is a clinical and research psychologist, professor at the Institute for Behavioral Health at Brandeis University, and adjunct professor of psychiatry at the UMass Chan Medical School. Joanne's research focuses on interventions and services and support for families living with behavioral health conditions and disability. Joanne always partners with people who bring their lived experiences. For the Bridges Project, her partners include a team of mothers living with intellectual and developmental disabilities. Welcome to you both.
Hi. Thanks, Helen. Happy to be here.
Well, as an occupational therapist, I did that before I got focused singularly on health literacy. I'm especially interested in ways to clearly and respectfully communicate with someone who has a disability. So let's take this from the beginning. That word disability, it can have many different meanings and scenarios. Tamara, explain a little bit more about what you mean by that term disability, your understanding of it.
Well, my understanding is that everyone has some sort of disability, and we're not sick people. We just want to be included, and nothing about us without us.
Nothing about you without you.
Right.
And when I think of the term disability and working as an OT, I remember there are people who have something from birth on. You said you wanted me to mention that you have cerebral palsy. So I assume that probably was from birth on or right around that time. But there are also disabilities. Someone can go blind later in life or go deaf later in life or, have a mental illness that comes and goes. Would those all be considered forms of a disability?
Yes. There's intellectual disabilities, there's physical disabilities, mental health disabilities, but we want to be talked to just like everybody else with just maybe some learning challenges or communication challenges.
Interesting. Learning challenges and communication challenges. Joanne, your research often focuses on people with disabilities. What brought all that together in your research? Why focus on that population?
I really care, Helen, that people get the help they need to do the things they want to do. So if they want to work, if they want to be a parent, if they want to go to school, if they want to drive a car. And I'm committed to finding ways to help people achieve the goals they set, to meet their aims so that they can do the things they want to do. And I personally think that everyone's brain works a little bit differently. That's me, the psychologist, speaking. And I think that we have to be respectful of the fact that everyone is a little bit different and each of us probably needs support for doing something or another. And there's no shame or blame in that.
So both of you are interested in the issues of communication. Tamara, you talked about nothing about me without me. Joanne, you're talking about that too. You're talking about people's goals. Let me just put this into context. This podcast can be listened to by anybody, but the primary audience tend to be clinicians or people in public health or people working at community agencies. What would you want them to know in their everyday work about communicating with someone who has a disability?
We bring value to our table by using our voice, and we belong at the table. And
Can I ask you a little more?
sure,
Give me an example. So I don't want to assume I know what you mean. You say we bring value to the table. I assume the table is a metaphor. You may or may not have a piece of furniture. But how do you mean the value? What can somebody bring to a conversation?
perspective. It took me a while to become the confident person I am. I used to be very quiet and I used to not be able to express myself. And through the Brandeis project, now that's changed. And I realize that I do have value and I do have good opinions and such. And I mentor people by lived experience.
Wow. Okay. So I was just taking notes there. So what you're saying is that you bring your perspective.
Yes.
Someone who's living this every day. You have strong opinions. That's almost how you introduced yourself.
Yep.
You have strong opinions, and you can not only do it for yourself, you can help others in mentoring them. When you talk about mentoring, are you mentoring other people with disabilities or are you mentoring professionals?
I'm mentoring both by educating them and advocating for them.
Advocating and educating. Wow, that's a lot you're taking on. That's huge.
Very busy.
Good. Busy in a good way, I hope.
Yeah, it is.
Joanne, what do you see that people can be bringing to this conversation when the value is in communicating clearly with people with disability? You talked about goals and helping people get to where they want to go. What else have you been learning by all this research you've been doing on this?
Well, I think that it's important to remember, particularly if you're a healthcare provider or an educator, that communication is a two-way street. And it's one thing to give people advice and recommendations to sort of tell them what to do about how to manage a problem or how to achieve a goal. But it's equally, if not more important, to listen to what that person has to say about what their goals are, what their problems are, how they're feeling, what they're thinking, so that you can work together in a two-way communication street, if you will.
You're another metaphor. We had the table, now we have the
Exactly.
street. Okay. Okay. I'm thinking about this back in my hospital or outpatient days. I was working with a patient and I knew more about that person and some kind of a basis for a relationship. But our audience includes people in public health. Chances are they don't have a relationship with people in their audience or they're talking to. It's community wide, or maybe they're a librarian or, someone in a senior center. What tips and strategies would you have for us even when you don't know their goals and you don't really have time to find out their goals? How would you recommend the librarian, sitting at the library and someone comes up with a question, someone who appears to have a disability, and I'm pretty aware that not all disabilities can appear like disabilities, but how can they have a respectful conversation?
I think it's really important to be humble, actually, as a librarian or as a healthcare provider or a teacher or educator, so that you're poised to learn as much as you can about the person in front of you. That requires you to be a really good listener. I think that many of us go through years and years of training where we're learning about how to speak in medical terms or research terms. We forget sometimes that it's really important to communicate in plain language and to ask questions and to listen to what people have to say.
To piggyback off that, I would also say talk to us directly
Exactly.
and treat us with respect.
What do you mean directly? You tell me what can go right and also an example of what has gone wrong and at times.
For me, people, instead of talking to me about my health or what's going on with me, they'll talk to my support person that is with me.
Oh, and not to you.
Right. Like I'm invisible. So I have to
Ooh.
constantly educate them.
Tell me how you do that.
I do it in many ways. I call them out on it. I say, can you please look at me when you're talking to me? And I have my support person position their care. And some of them address the doctor by saying, well, it's not my health care. Can you talk to her? I'm not here at the doctor for me. I'm here to support her. So you need to direct all your questions to her. And we're not patients, we're people.
There are times we're all patients, but you're a person first.
Yeah, person first.
Now, Tamara, I know your work a lot is about self-advocacy. It seems that it would take a lot of courage to speak up to a clinician and say, excuse me, look at me. How do you get the courage to advocate?
I finally realized that I need to speak up for myself and others because it's so important. It's so important that we're empowered because we have the right to choices and decisions and to make our own decisions. Somebody shouldn't be doing that for us unless we give permission.
Did you learn how to do this, or is it just a part of who you are?
I had to learn how to do it because I had to learn what was important to me, and I had to find out what I really wanted in life. So a lot of soul searching. But I mean, I've always advocated for different things. I think it's part of my makeup. My grandmother always used to say, you're going to be a great advocate. You always speak your mind and you're going to make legislative change. And that's what I'm doing.
I think it's interesting for me to hear Tamara talk about those things because I think that's good advice for everybody. You know, whether you identify as a person with a disability or others think of you as a person with a disability, to be able to speak your mind and feel that you're being heard and that you are at the table having a two-way conversation. I think that's about respect. That's helping to build trust with your provider or your teacher or whomever you're with or your family member. I think Tamara's advice is actually good advice for everyone.
I do too. Now, the project that you're both working on, Joanne, it's your research project. Tamara, you're a participant in this. I may not have all the terms right. It's called the Bridges Project. If I understand it correctly, it's about moms living with intellectual and developmental disabilities. That's interesting to put together what we're talking about, communication and respect and disability and intellectual disabilities with moms. I don't know if these are brand new moms, early moms, or tell us more about this and what you'd want this audience to know about talking with moms who might have disabilities.
Should I go first?
Sure.
I can go first, but I'm interested to hear what Tamara has to say.
Sure.
I think it's important to ask mothers what they want, what they need. A big part of our project is finding out from mothers what matters to them, what outcomes matter with them, what their families need, what they need to do the kind of job they want to do as parents, to be the kind of, in this case, mothers they want to be.
Joanne, I'm going to ask you to put in your everyday scenario storytelling hat. Tell me what a mom might say as what they need or what they want.
Well, I think I'm trying to think of a good story. Tamara, can you think of a good story? Mothers, they want what's best for their children.
Yes. And our children are our priority. And we want to be heard and empowered and believed in. Yes, we can do this. And acknowledged that we're good parents because we are. We're great problem solvers. We think outside the box. And we have to get rid of some bad assumptions there are. Like I can remember this time that I was at the doctor's office and I went in there and I was going to give blood and the nurse took my blood and she patted me on the hand, and it was so condescending.
Oh,
She treated me like I was a child, and she said, "Okay, dear, you did a great job." And I was quite older than a child, and she offered me a princess band-aid to put on my blood work. And then I said, "Thank you. My daughter she's really into princesses, so I'll give her this band-aid." And her whole face dropped because, you know, people think that people with disabilities shouldn't or couldn't have children.
wow.
And that's so far from the truth.
Thank you so much for sharing that and for being what a model you are for advocacy. We just have a few moments left on this podcast. What we are doing in this podcast, and I've started doing it more in podcasts, is bringing in people who experience whatever the topic is on an everyday basis. Tamara, I'm learning so much from you. You're right. Nothing about you without you.
Mhm.
We need to hear this from you. Joanne, obviously, that's central to the research you are doing. For either of you, do you have other recommendations you'd like to make for the listeners of Health Literacy Out Loud?
Just to be open and be yourself and to ask questions. Don't be afraid.
Exactly. And Tamara said this earlier. Everyone has something to contribute. You have something to contribute to the conversation, to the research, to the practice of medicine. You have something important to contribute based on your lived experience and your wisdom about what it takes to make things happen in your world. And so I think Tamara has really done a nice job of summarizing all of that.
And I think from the professional's perspective, too, to know that you as the professional also have something to contribute and to be respectful of that and be inquisitive enough to find out from the other person.
Exactly.
Both of you, I thank you so much for suggesting this topic and for being guests on Health Literacy Out Loud. I learned a lot. I bet our listeners would too. Thank you both.
Thank you.
As we just heard from Tamara Huntley and Joanne Nicholson, it's important to include and be respectful of everyone we're communicating with, even those who have disabilities. But doing so is not always easy. For help clearly communicating your health message, please take a look at my book, Health Literacy from A to Z. Feel free to also explore my website, healthliteracy.com, or contact me directly at helen@healthliteracy.com. New Health Literacy Out Loud interviews come out the first of every month. You can get them all for free by subscribing at healthliteracyoutloud.com or wherever you get your podcasts. Please help spread the word about Health Literacy Out Loud. Together, let's tell the whole world why health literacy matters. Until next time, I'm Helen Osborne.